And welcome, ladies and gentlemen, to this very special episode of the news briefing for the 12th of August. Yes, 12th of August already, and time does fly, as they reckon. So today we're going to look at what the restrictions mean in Queensland, Victoria and New South Wales. Also, we will take a look at some of the functions and events taking place. So right now, let's join our Premier with that update.
Everyone, it's wonderful. All right, good morning everyone. It's wonderful to be back with you all. So good morning Queensland and good morning to all our Facebook Live listeners. So I want to give a few updates and then talk about our path forward and just give everybody an understanding about what's going to happen over the next fortnight. So I can advise that we've had 9 new cases overnight, 7 are locally acquired and linked to the Indooroopilly cluster. So that's all good news. Then we have 1 case on the Gold Coast that's under investigation, so Dr. Young will talk to you a little bit more about that in a moment. But we do have 1 new case in Cairns. Now, we are quite concerned about this. It's a taxi driver and he has been infectious in the community for about 10 days and he lives at Kanimbla. So I'll come back to that in a moment. So we have 148 active cases, 26,286 tests in the last 24 hours. So again, good testing results. And
so, ladies and gentlemen, we will go to today's live and catch up everything that's happening up north.
As well, welcome, and it's a beautiful day here in Queensland. So we're standing on the site of where our new performing arts complex is being built, but we'll be talking about that a little bit later. I've got the Arts Minister and John Copsis to come here and talk about that. But let's give the COVID update first. So in more good news today, we have 11
Ladies and gentlemen, they got disrupted. So anyway, we'll see if we can reconnect with that stream. Now there seems to be a problem with that stream, so we'll go on and look at New South Wales in the meantime.
Those on the edge of Sydney's hotspots are on edge.
I'm actually kind of so scared to come to the work.
The fact that it doesn't seem to be getting any better doesn't make you feel any better.
The Inner West, Burwood and Bayside, these are the new frontiers of the COVID crisis as the virus spreads from neighbouring suburbs.
Health may very well say to government today or tomorrow, the next day, as a precaution, we want you to lock down.
Life here is already getting harder. 2 workers at the Leichhardt bus depot have tested positive, forcing the cancellation of some services.
Just frustrating, but what do? You just have to get to work.
You rely on the service and you think the drivers are being careful, but...
The situation is stabilising in Canterbury Bankstown, but locals are still doing it tough. Amin El-Barini is organising essentials for the elderly.
It's like a sense of belonging to the place, so we all are trying to do our best. We all coping with the restrictions and what the government is asking us to do, and we hope we'll together get through it.
Not everyone's so considerate. This 50-year-old man has been charged after allegedly punching a nurse in the head at a testing clinic in Dundas. Rebecca Boycheska says staff are regularly abused.
We get people screaming out of their cars, disrespectful language, terrible things.
Another 344 people have been infected and 2 men have died. One was in his 90s, the other in his 30s.
He was not vaccinated but had some significant underlying health conditions.
Yet another aged care home is in lockdown, this time at St Mary's. A nurse has COVID, but most residents are vaccinated. Playgrounds have become a respite for many parents stuck at home with little kids, but this one at Bardwell Valley has become a potential exposure site, making some families nervous.
It's really, really scary.
In Sydney's east, dozens are taking advantage of the warmer weather. But authorities have this warning.
So once again, once you've done your exercise, please move on.
We're in a lockdown and there's more people out than usual. It's not good.
I think it's okay as long as everyone's socially distanced and following the rules.
The whole city is depending on that. Kathleen Calderwood, ABC News, Sydney.
Well, of course, when we look at the numbers now, it is very, very bad. And right now, Dubbo is in lockdown as well.
In breaking news, a number of new local government areas in Western New South Wales have gone into lockdown tonight. Gary John Lysart is in Dubbo for us. Gary, what are the areas affected?
Yeah, good evening, Jeremy. Additional areas in northwest New South Wales are going into lockdown from 7 p.m. tonight. The local government areas of Walgett, Bogan, Burke, Brewarrina, Canamble, Gilgandra, Narromine and Warren will all be under the stay-at-home orders. It comes after a COVID positive case went to Walgett, leading to several close contacts, and those orders will remain in place for at least a week. But Jeremy, here in Dubbo, where lockdown started as well today, there's been a lot of feeling of inevitability that it was only going to be so long before this lockdown would start. Obviously, businesses are concerned about the impact that it's going to have on them. But there's also a hope that a lot of people will come together, follow the rules, and hopefully get this lockdown over with in a week's time. With just a few hours' notice, the Dubbo lockdown was locked in. 2 people have tested positive to COVID-19, one linked to a local primary school.
The people that have been infected with this virus are scared. I know the community's scared. This is the time for us to come together.
People came out in large numbers for testing, some waiting up to 5 hours. Everyone's being urged to stick by the rules.
The time for education has passed, so police will be taking an enforcement stance in relation to the public health order.
Police have now charged.
So right now, as we can see, that the regional areas are being closed as well. As the virus has spread, and of course, when we looked at Byron, that person from Sydney who went there has been arrested as well for bringing it there and for violating the border restrictions and then making it there. So that's what happens. And welcome to the South, JP Sodim. And he's had his number 2 Pfizer yesterday. All the best of luck with you for that. He and his wife had it. No pains and no side effects, but they did have to drive 45 minutes. So well done, mate. It's good to see that's been it. Right now, we'll join our Premier as he makes that big announcement up north, and hopefully our connection goes through this time.
All right, good morning, Queensland, and good morning to all of our Facebook Live followers as well. Welcome, and it's a beautiful day here in Queensland. So we're standing on the site of where our new performing arts complex is being built, but we'll be talking about that a little bit later. I've got the Arts Minister and John Copsis to come here and talk about that. But let's give the COVID update first. So in more good news today, we have 11 new cases, but 10 of them are all linked to the Indooroopilly cluster, and they're all in home quarantine. So that's fantastic news. And one person was detected in overseas in hotel quarantine from overseas. So that's fantastic news. We're very happy with that. And we're expecting to see that increase in numbers because people are getting tested on day 10 and day 11. And we do expect to see similar numbers over the next couple of days as that cluster keeps progressing through and having their day 12 tests. We have 15,334 people in home quarantine. We have 155 active cases. Great news, over 31,000 tests in the past 24 hours and 3,341 tests in Cairns. So that's fantastic. And thank you very much for the residents in Cairns for coming out. And please, Queensland, remember, if you have any symptoms, it is absolutely imperative that you go and get tested. So please keep that up. That's fantastic. 16,226 vaccines were administered by Queensland Health in the past 24 hours. And the vaccination centre yesterday went really well. We were out there yesterday. 1,465 people received their vaccine. And we have, over the last 3 days, 116,000 people have registered with Queensland Health to get their vaccine. So that's, again, really, really good news. So can I just say to the families that are in home quarantine, and some people have questions about once they receive that negative test, what happens? Can you please contact your school, the school that your child goes to? They will have all of the dates that are applicable to your particular child. But if you have any questions whatsoever, please ring 134 COVID and Health will give you some further advice as well. So please, there's a lot of questions out there about when people can leave. It's important they stay for the 14 days. So just because you receive a negative test doesn't mean you can leave your home. This is very important that people do not leave their home until they have checked when they can. So that's absolutely critical. And I do want to thank the public for doing the right thing. Everywhere where I've been out, I've seen people wearing masks. And of course, to all of our high school students, I know it's been a hard adjustment, but thank you very much for what you've been doing there. Okay, so just about some other issues across the nation. So in relation to South Australia, as of midday, anyone from South Australia will be able to leave their home quarantine as long as they have a negative test result. And of course, we'll be opening up to South Australia as well. But you have to fly in, you can't drive through because of the situation in New South Wales. With Victoria, they are extending their lockdown, so all the restrictions about Victoria remain. Now I want to say this to Queenslanders, especially to Queenslanders on our border with New South Wales. We are very, very concerned about the situation in New South Wales. What we are seeing now is more of these regional communities close to the Queensland border, especially out in the southwest area, are now going into a period of lockdown. We are very concerned. The Deputy Premier and I will be having a phone hookup with our mayors along those border communities just to reinforce to them that no one should be crossing that border to go into New South Wales at this stage. Can I say to Queenslanders who live on the Gold Coast, New South Wales border as well, or to any Queenslanders in southern parts of our state, please do not cross into New South Wales. We will be monitoring this situation extremely closely over the next 24 to 48 hours. We do not want to see this virus creeping north, and if we have to implement harder measures, we will. So I'm please urging Queenslanders, do not go into New South Wales. Of course, we have those essential workers that have to, but now is not the time to cross the border and do your shopping. Please stay within Queensland. And also too, we'll be talking, Health is at the moment talking to those mayors, and we'll talk to the mayors as well about actually increasing our vaccination to the Queensland communities that are on that border. So very, very concerned about that, and I'm quite sure that this will be an issue that will be raised at National Cabinet tomorrow as well. So anyway, stay safe everyone. Keep up that great testing rates in Queensland, but also too, that check-in app is really, really important. So just a reminder to make sure that you are using that check-in app when you are going to cafes, restaurants, out and about with your daily routines. And to all the people in home quarantine, you are heroes. Thank you so much for what you are doing. If you weren't staying home, you know, we don't know what would have happened. So thank you so much. And as we see, whole households are actually testing positive with this Delta variant. So they have done a mighty job, and I'm really, really proud. So I'll hand over to Dr. Young.
And there we go. That's the latest. As we know that the outbreak in Sydney and creeping into the regional areas is very alarming, as the Premier said as well. So as JP Sony mentions that we should just close the borders and seal Queensland. Well, right now, if you look at New South Wales, a man in his 30s has died, and the record number of cases coming on there as well. So let's take a look at that report.
The 52-year-old Sydney man who triggered the North Coast's lockdown with breaching public health orders. Zoran Radovanovic and his 2 children allegedly drove to the Byron area last month and have since tested positive. Elsewhere in the state, Bathurst Jail went into lockdown after a prisoner released on bail on Monday tested positive. The 27-year-old man had travelled to Walgett, nearly 500 kilometres away. As a result, the Walgett LGA has now also gone into lockdown. In the Hunter, more cases have been detected.
So Hunter does not look like it'll come out of lockdown later this week.
11 residents of an aged care facility in Edgeworth have tested positive, as has a second staff member. There was better news from testing at another facility at Waratah, which also has an infected worker.
They have all come back negative. That is for all the residents and the majority of the staff.
With COVID being detected in a growing number of regions, sparking snap lockdowns, some say a statewide lockdown might need to be considered, depending on how the situation progresses.
If there is shown to be more cases and a real concern about transmission, that would be looked at.
No longer confined to Sydney, reining in COVID-19 is proving a major challenge. Gary John Lysart, ABC News, Dubbo.
Well, of course, now that it's reached Dubbo and getting into the regional areas, as we know, locking down regional areas becomes very hard. Large farms and things like that is very hard to monitor as well. So, there are logistic challenges there as well. So it is very, very terrifying news now there, especially in New South Wales, the way it's spreading. Well, what about Melbourne? It's gone into an extended lockdown as well.
A typical Melbourne day brought the news we were all expecting.
Too many unanswered questions, too many mysteries for us to safely come out of lockdown now.
While another week is unpopular, some took it harder than others.
We've been made a priority.
A heckler at today's press conference was tackled by police, while the Premier maintained that it's the only option.
If we were to open, then we would see cases akin to what's happening tragically in Sydney right now.
The border with New South Wales will again be strengthened. All bubble residents will need a permit to enter Victoria from Friday.
If this virus can get from Sydney to Byron Bay, to Dubbo, to Armidale, to Tamworth, then only a fool would think that it couldn't get to Albury.
So the government really needs to rethink this, because this is not fair for those border communities.
Victoria recorded 20 new cases today. 14 were in isolation while infectious and 5 are under investigation.
It's likely if they haven't been able to find the source of the mystery cases, they may need to extend that a little longer.
2 of today's mystery cases are from the city of Melbourne. A grade 1 St Michael's primary school student and his father, who worked at a Royal Children's Hospital eye clinic on Monday.
We've got cases that are not just confined to a couple of suburbs in the north and west. They really are quite extensively spread.
Melton has emerged as a new area of concern. The other mystery cases include a family of 3 there. There are more than a dozen exposure sites along the retail area of High Street, with more expected.
We now have 13 active cases in the City of Melton area. 6 of those are new cases today.
Most people in Melton have been respectful of what's to be done. When to be tested, they're going to get tested.
Residents in Caroline Springs have heeded calls to get tested. 1,200 people got swabbed there yesterday, with 4 more cases linked to the CS Square shopping centre. The list of exposure sites is growing. There are now more than 300 locations, including this apartment complex on Elizabeth Street in the CBD. While it's the 2 mystery clusters that have authorities most concerned right now, they are confident they'll be linked in the coming days. The Premier says it is possible we'll see 100% of new cases in isolation while infectious before next Thursday, the magic number needed for the lockdown to lift. Bridget.
So whether they'll reach that magic number needed for that lockdown or not is a the big challenge there as well, as the new cases do come out as well. So we have seen that this COVID-19, the Delta variant, has been very sneaky, and it just gets into the areas. And one of the things is, why are people still traveling? Unless you are, I thought it was made very clear that unless it is absolutely essential, just stay home. And if you manage to get to the offices or whatever, just be there. Don't be out and about and things like that. Work from home as much as you can. Borders need to be closed. That's the only way. Otherwise it just keeps spreading and spreading, and the uncontrollable it is at this point in time. Everyone wants to be at work, including Deputy Prime Minister Barnaby Joyce, who is out in the country, and he says all the poorer people live out in the regional areas, and he is stuck in an area, but he also wants to get to Canberra to do his work. Well, so does many other people as well.
COVID lockdowns across regional New South Wales this morning. One of those caught up in it is Deputy Prime Minister and Nationals leader Barnaby Joyce, who joins us now from Armidale. Good morning. How's lockdown treating you?
Well, I'm actually in Dangle-Murray, and as you can probably see, you don't really notice the difference out here. It's someone has to tell you they're in lockdown, but of course you notice it. Excuse me. If you get, that's not COVID, it's a cough. Yeah, you notice it if you go into Tamworth or if you go to Armidale, and the town's just about dead. You've got to make sure, and I'm sort of making sure I try not to see anybody, because I want to try and get back to Canberra as quickly as possible. And so we're trying to organise that if I'm in real isolation, I've got an opportunity to get back to work, which is precisely like everybody else in Australia, where I want to be.
Well, should there be a tight ring of steel around Sydney to stop the movement into the regions, given that we've now got another 8 LGAs that are in lockdown this morning?
Well, my biggest concern, obviously, Lisa, is what you just had a report where it said the richer people are, the healthier they are. And of course, the poorest people are in regional Australia. That's, I always try to remind everybody about that. The people who are doing it the toughest live in the weatherboard Nine, in the small villages that are around the hills here. And if COVID gets into there, we've got real problems, because there's a lot of comorbidities. We've got a high Aboriginal, they call themselves Aboriginal in our area, high Aboriginal community.
Yeah, so should there be that ring of steel?
Really careful of that. We've got to do everything we can to make sure. I'm not going to tell the New South Wales government how to do their job, but I do not want COVID in Aboriginal communities. I don't want it in basically the people who are doing it tough in the little villages and the ones I grew up in, because they won't have the health facilities that you got in Sydney. And some people will just pretend that they can deal with it by themselves, and people who are doing it tough will find work where they can, and it just won't work. It'll be a really bad outcome. And for gets out, especially out west, the further west you go and the remoter they go, the worse the effect will be. So we've got to do the right thing.
Given that millions of Australians are in lockdown this morning while we're watching the rest of the world starting to open up, isn't that an indictment of the federal government's actions in trying to control this pandemic in Australia?
Well, I don't quite agree with that. Even areas that have full vaccines, I suppose Gibraltar or Iceland, this Delta variant means that the disease gets going again, the pathogen gets going again. There are areas that have come out of lockdown that have now gone back into lockdown, even in areas in the United States. What you got to judge yourself by, Lisa, is whether people die. You don't have a vaccine. We need people to get vaccinated, but you don't have a vaccination just for the purpose of a vaccination. You have a vaccination for the purpose of trying to stay healthy and not dying. And Australia's been incredibly lucky, blessed, and well managed in that process, and we want to continue that. And I say to everybody, if it's not even your belief of the vaccine, then believe in the economics behind it, because we've got to get this economy going. We cannot just keep going back and borrowing further and further money to try to roll out further and further essential programs. So the vaccinations are coming in by the millions.
So there you are. As the Deputy Prime Minister said that, he wants to get back to work, and of course we need to keep this variant under control. And if people keep traveling here and there willy-nilly, then of course it will be very, very hard to control. Well, right now let's take a look at some of the functions and events taking place or being planned under these circumstances. Well, ladies and gentlemen, that's about all we have time for you in this segment. Until next segment, it is goodbye from me. But don't forget that Gopio Queensland's India Day Fair has now been postponed. It's not on this Sunday, so it is now on the 23rd of October at the same place, at the same venue. But on this Sunday, Gopio Queensland has a gala dinner happening at Queensland Parliament, a very small function which has been organised very quickly because 15th August has to be observed. So until next update, next bulletin tomorrow morning, it's goodbye from me.